All right, so we have with us today Chris Chandler. Chris Chandler is hospital administrator at Monroe Regional Hospital. Chris is a longtime friend, faithful brother. We served together in the same church for many years. Kids play together, spend a lot of time together. Chris is with us today as our healthcare expert, and we have Mr. Cory Uselton. Cory is Superintendent of Education for Desoto County Schools, and is going to help us understand a little bit about what COVID-19 means for school and education in general in our area. And to my immediate left, Tom Ferguson, who is the mayor here of the city of Hernando. I appreciate each of these men coming and being with us today and taking a few minutes to share about the impact of COVID-19 in our community and some ways that we might respond to that. I'm going to begin with Chris and just ask, as a healthcare professional, how concerned are you about what's going on right now?
Well, that's obviously a great question, and I appreciate the opportunity to be here. One of the conversations we were just having was the concern about misinformation. There's information coming at us from a myriad of different places, and it's important that we're getting it from the right places. Obviously, the CDC website and State Department of Health, those are the most accurate on the healthcare side of things. But as far as being concerned, I'm somewhat of a unique hospital administrator. I'm a nurse, came from a nursing background, worked in the ER for a lot of years. And we are guilty as healthcare workers of not being fearful sometimes. We just we jump in the line of fire and we don't worry too much. This is a virus that is very concerning in the fact that it's so contagious. You hear the comparisons about, well, it's the flu, it's just another flu. And that's not true. It is contagious, it is a virus, but the ability for it to be transmitted is quite high, and we worry about our vulnerable population. So as a healthcare worker, as a nurse, as an administrator, as a dad, I'm concerned because we need to be. But you have to keep that in check with what the gospel says and what we're called to be, not fearful and trust the Lord in all things. But it's serious.
One of the things that makes this so difficult to really understand, to grasp the magnitude of this, is just the testing process. Right. Chris, can you talk about who should be tested? What are some symptoms that people should look for that would compel them to be tested?
Sure. I'm sure most of you are aware of the symptoms at this point are flu-like symptoms. Fever is a major one. Other upper respiratory tract type symptoms, cough, those kind of things. So that makes it difficult because it's flu season and there's other colds that are going around. Testing is important, but we're running into an issue with a lack of supplies in order for us to test the way we should. And therefore, not everyone who wants to be tested is tested. So right now, the recommendation is that you either need to have been exposed to a known case, or you need to be a very sick individual, even a hospitalized patient, or somebody that's more vulnerable than the other, that's at more higher risk. And basically, it's due to a supply issue. If we had a myriad of tests out there, or a lot of tests, we could test more people, but that's not the reality right now.
Obviously, this is more than just a healthcare issue. Now, COVID-19 is, in my estimation, as much an economic crisis as it is a health crisis. There are a myriad of ways that we're being impacted by this, education not the least of them. Mr. Uselton, I'll ask you, and I think this is a question that many will tune in to hear an answer to. What does the remainder of the school year look like for DeSoto County students?
I feel like our decisions right now need to be made day to day. It's just everything's changed so much over the last week with all of our lives, and at the same time the information that we're receiving from the national level and from the state level. And so I've cautioned parents that we need to be very patient in our decision making moving forward. Our plan right now is to each Thursday to give an update regarding the upcoming school week. So every Thursday our parents can expect over the next few weeks, if we're out of school for an extended period, that we'll give an update on what's going to be happening in the weeks to come. we'll have a board meeting each Thursday, so we can make a decision there and then announce it soon after. We're making plans to be out long-term if that were to happen, and so starting next week, parents will be contacted by their child's teacher about distance learning assignments. From an education standpoint, just purely academics, we have concerns about students missing possibly a whole 9 weeks of the school year. Obviously, at this point where we are, academics is not the number one concern. Safety is the number one concern. And so we have to look out for that part first for our students and our employees. But at the same time, we have an obligation to parents academically. And so this week, all of our employees started working. They're all working. It's a matter of some of them are working at the school, some of them are working from home, wherever they feel comfortable. But getting plans in place so that students can still get an online education as much as possible over these next few weeks.
Apart from education, the economy, as I mentioned a moment ago, is a major concern, I think, for a lot of people. We're watching the markets go up and down on a daily basis. Tom, can you talk about the local economy and how things are going locally?
Well, thank you for having me today. I appreciate that. We are in an exciting town with a growing business community. Right now, I've been working with the Chamber of Commerce. They have been working with the other chambers for information. We're all seeking information. Most of our businesses, whether restaurants, small businesses, have been offering the best they can, curbside service, pickups, things of that nature. And we encourage people to still shop locally if needed. They depend on us and we depend on them. So we're hoping they can stay in business and keep going.
Sure.
I know it's going to be a little downside, but hopefully things will get better soon.
Right. And I would encourage, and I'm sure you would echo this, if you can shop locally, support our local vendors, local
Absolutely,
restaurants.
yes.
Absolutely. As of today, the news hit that we have a confirmed case in Hernando. Is there anything that you can, and I understand if you can, is there anything related to that you could speak to? Any comments you'd like to make about that?
Absolutely. Well, today we put a plan in place. We're going to close City Hall to the public. We're not closing City Hall. We want businesses to continue. You will be able to pay your water bills online. You can pay your water bills by mail and the drop box. We got 2 drop boxes at City Hall. We encourage people not to be in our presence. We don't want to be in their presence. You know, we're looking out for each other. You will be able to conduct business. If you need a meeting, we'll make a phone call and you can set up and have a meeting. Now with our first responders, we put in place, we will check their temperature on every shift change. We will log it to see if it's a big change, something of that nature. We're looking out for the best of our employees and the citizens of this community.
Good deal. Chris, as I mentioned, is hospital administrator at Monroe Regional Hospital in Monroe County. What makes that of interest is that Monroe County is among a handful of counties with confirmed cases. In fact, Monroe County was an early county, I think the 3rd county with a confirmed case. Once there are confirmed cases in an area, as there is in Desoto County now, Chris, are there additional steps that should be taken? Is there anything that we need to be doing differently given this confirmed case?
Well, I think it's obviously a heightened sense of awareness. You know, it feels like it's in theory until it hits in your backyard. And certainly, all of the recommendations don't change, but I think it's folks are more diligent about following the recommendations once it hits home. We as a hospital obviously are as prepared as any other hospital, and there are many mechanisms in place to treat patients. One of the things that we're combating right now is just fear to come to the doctor. Nobody is getting out at all. And there's good reasons for that, but there's a fine line between risking your health, staying at home, and not coming to be treated. So we do have screening processes in place at every clinic at the hospital, and we're narrowing down our entry points, those kind of things. So we're screening every patient that we see. That way, if we feel like at the door that they're symptomatic, sometimes we'll actually encourage them to go back to their car, and our providers are actually coming out to the car to further question them. It's just a way to make sure they're protected and our employees as well as the public is protected. But it's interesting times in healthcare.
Sure. Cory, with school being out, a concern that was raised immediately, and reasonably so, are the children who depend on school lunches. That's a source of meal, of sustenance for many of the students that come through. I know that there are efforts that have been made. There are plans in place for providing for these needs. Can you share with our audience the when, the where, the how, with finding meals for children who may find themselves under these circumstances?
Sure. As soon as we knew for sure that we were going to be out for an entire week, we started turning our attention to those students because, as you said, they're depending on the schools during the day for those lunches. And so our child nutrition team worked diligently to get plans in place. I've been so impressed with the work that they've done this week. Today we actually started serving students almost like a drive-through situation at schools. Today we started at Horn Lake Intermediate School, South Haven Intermediate School, and then Chickasaw Elementary School in Olive Branch. So we've got the Horn Lake, South Haven, and Olive Branch communities taken care of there. Part of it started that way because of federal regulations and free reduced lunch rates and things of that nature. So those were the 3 spots we started in. And then by early next week, we expect to have Hernando Hills Elementary School set up, Walls Elementary School, and also DeSoto Central Elementary School. So we'll have 6 schools throughout the county, and those are going to be centrally located enough to where we feel like anybody around the county could get to those schools if they need to, and that's for people 18 years and younger, and so they can come each day and get lunch, and we'll know that that's provided for them.
Great. Cory and Tom, we obviously, as a faith family, as a church, we want to do everything that we can to be of service to our community and to the area. Of course, specifically with students being out and education needs moving forward, food needs for families, are there ways that the church can network with the school or be supportive in some way to the provision of these meals? Are there any needs that have arisen that the church could meet in some way?
I want to go ahead and say that as a school community, we're appreciative of all the prayers and support that we've already received from our local churches. And we've already had several church groups reach out to us regarding meals, and we've put them in touch with Jerry Hill. She works at our central services and is our community outreach coordinator. We've got other community groups that have reached out about the meals and students in need, and that's helpful at the moment, but I also think that as the weeks progress, if we're out of school and this continues like it's starting to look like it may, that other needs will arise during that time. And so I would just, ask our churches if they're interested in helping, to continue to reach out to us because those needs could change in the upcoming weeks.
Sure. There are in this major needs, serious needs, and then there are the lesser needs. But I'm going to ask this question, realizing this is not the most important thing in the world, but it's a question that people in our community are asking. Tom, what does spring and summer rec sports look like in our area?
Right now, we have postponed. As we're hoping this will be over with or moving forward early April. We have plans to continue with rec baseball at this point in time. As the time continues on, if it gets worse or gets better, we're playing that day by day, what we have to do. But we have plans to continue on with our spring and summertime sports.
Great.
I mean, right now under CDC, we don't need to be congregating more than 10. And those baseball people will be working from home this week, and they're going to put together the draft. We are going to move forward as much as we can.
Okay. And the parks are closed right now?
The parks are closed right now.
Okay. All right. Are there ways, Tom, I'll ask you the same question I asked Cory, are there ways that the church can assist the city, ways even that the community can be of service to the city in some way?
Well, we're very appreciative of the churches, and we do appreciate your offer. Right now, would not have been able to get a group of people together and all that. I just ask that you continue doing your worship the best you can and reach out to the people through Streamline or whatever means you have.
Sure.
Because we need the good Lord at this time. This town does, this community. And if you're working with food banks or things like that, continue the best you can under the guidance of the CDC and the Mississippi State Department of Health.
Sure. One of the challenges in all of this is just a lack of clarity and communication. we can control what we say, but we have no control over what people hear. And that makes things interesting sometimes. Trust me, I understand your plight as you speak into this situation. Cory, I know that earlier this week I was following along with a news story, and all at once my phone exploded over the idea of being out of school for a full 180 days. My immediate response was, I don't think that's right. And the 180 number rang a bell with me. It sounded consistent with contracts and a regular school year and those sorts of things. I know that was an incidental and certainly no malice in that mistake. But are there other miscommunications, anything that you'd want to make sure is communicated with crystal clarity to DeSoto County students and their families?
Well, I think starting out talking about that, it'll kind of lead into what all happened over the few days when decisions were being made. We talk about the 180-day requirement, and one of the reasons that came up is because last Thursday, Shelby County Schools had announced that they were going to close for 2 weeks, and we were on spring break at the time. And oftentimes, just like with snow days, we'll get questions of why do we have to make up days when they're not having to make up days in Shelby County. Tennessee schools are on an hourly requirement, so they can add time into their schedule so they don't have to make up days at all. We're on a 180-day requirement. And as school district superintendents were calling each other all during spring break week, trying to make sense of the guidelines that we were going to have to follow regarding the following week. There is a pandemic index that we were referred to that we had to follow the requirements of. In all fairness to people in Jackson, when those types of documents were written, now that the event has actually occurred, I'm sure there'll be some things that were rewritten, because things in there were like school closures can occur once there is a cluster of cases in a school, things of that nature, where obviously we're sitting here at that time with no cases. And the Mississippi Department of Health at that time had recommended no school closures. And so what a lot of us had done as superintendents is we honestly wanted to get another extra day or two into the next week to find out what was actually going to transpire. And that's the reason we came out and said, well, we're going to have staff development day Monday and then go to school Tuesday. Even at that time, I didn't know if we would actually go to school Tuesday because all the news was getting worse. But following up with you on what you said about the 180 days, is that was at after our special call board meeting Sunday. One of the reporters, it was actually our local DeSoto Times reporter, asked, are you hoping to get these days waived where you won't have to meet the 180-day requirement? Well, one of the Memphis news stations heard that and kind of misinterpreted what he was even asking me. What I was telling him is, yes, we're going to appeal this to the state board, because you can ask for a waiver to where you wouldn't have to make up the days. Let's say if you miss 10 days and the state board approves those 10 days as not having to be made up, you would only have to go 170 days. Well, then that was my one restful night, because we had gotten everything behind us. And then my son brought his phone to me and said, Dad, what's this all about? And I said, I have no idea what you're talking about. And apparently it was blowing up social media that night. And so we, luckily for us now with communication like it is, we were able to send out information that night to parents, because as soon as I saw that, I said, look, I'm sending something out to parents tonight because I want them to know that's not accurate. And because I had a senior from a high school contact me and just say they were just so worried to hear that, because that meant their senior year would be over with. And so you're exactly right. It's so hard to get out the correct information, and we ask our parents all the time to rely on the information that we send to them. We're going to email as much information as we possibly can in a timely manner, but at the same time, as I said earlier, to be patient with us, because this is day to day. I mean, this is uncharted territory. We're just trying to make decisions every single day based on the best interests of our students, our teachers, all of our employees, our parents, our community. And it's a challenge, but I know working with our community that we both have a trust in each other. It's a mutual trust that we're all doing what we can for the community right now.
One of the encouraging aspects of all of this for me, Chris, has been the extent to which the 99% who should not be overly vulnerable to this virus have been willing to make sacrifices for the 1% that is very much vulnerable. I think that ultimately this is a pro-life issue on some level. On the flip side, one of the concerning things to me has been the flippancy with which this has been treated, given the fact that this seems to be dangerous for a small segment of our population, those who are immunocompromised, the elderly. I know that this strikes close to home for you with a special needs daughter, and you have some added insight as a healthcare professional. Could you just speak to that? Just share your thoughts on
Sure.
that.
Well, I think we're all guilty of wanting to not take this seriously. It's something that we flippantly talk about, and we say, oh, this is no big deal. And it's not a big deal to the 99%. And so the responsible thing for us to do is just adhere to what we're asked to do, and to be thankful or thoughtful rather of others. I think about my little girl. She's 5. She has a myriad of special needs, and I have to think about it as a healthcare dad. So when I come in the house, I need to think about that. I need to not go grab her up and hug her. I need to go change my clothes, wash my hands, those kind of things. And we just need to be careful about our speech and how we talk to others. We just don't need to be insensitive towards human life. It's a valuable thing, and we need to treat it that way.
Absolutely. Tom, any message that you'd like to share with the folks of Hernando?
Yes, absolutely. I mean, we all need to understand this is probably going to get worse before it gets better. But
That's right.
all these testings are coming out. More people are being tested. We don't need to panic. We need to get the true and correct information to our citizens and our employees, and that would be through the Mississippi State Department, Health Department, and the CDC. The city, we are monitoring that daily for changes. We're having to make decisions daily. Sometimes we made it, like today, we made a decision and 30 minutes later we had to change it. There's so much happening and so much information out there, but I'm sticking with what our state of Mississippi is putting out and the Central Disease Control of this federal government.
For both of you guys, just a quick yes or no is satisfactory. It seems like you guys are getting a lot of this information at the same rate that we are as the public. Is that accurate?
That's pretty accurate. Most of the time, we had a conference call with the Mississippi Department of Education and the Mississippi Department of Health Monday. At the same time, though, anytime the governor announces that he's about to have a press conference or he's going to be on Facebook Live taking questions, I'm tuning in just like everybody else because I want to see what he's going to have.
Right. Well, we had a special call meeting last week, had a regular board meeting last night, and part of it was an executive session of some of the measures we're putting in place. But our main goal and interest between us all, we're all agreeing it's about the citizens and the community.
I ask that as a plea to those watching to be patient.
Correct.
Because as a pastor, I'm leading on, there are not as many people under my stewardship as there are yours. And it's a very fluid situation, and you're doing the best you can from one minute to the next to make a good decision based on what you know, and what you know may change in 10 minutes.
Absolutely.
It really is.
Chris, we've known one another for a long time. We've served the Lord together. I know you love Jesus. How has your relationship with Christ impacted your response to this?
I think it's about a perspective. Certainly the humanness in us wants to get scared and make rash decisions, but I think having a relationship with the Lord just grounds you in the fact of who's in control, and that no matter what the circumstances are around us, that we have a sovereign Lord that's over all of these things. So I take great comfort in that. One of the things that I've been thankful for, as much as we like to complain about the inconveniences that are out there, I'm thankful that this is happening in a time where there is technology. There we can get the word out, and lives can be saved in that way. There's so many opportunities from the gospel perspective. I think about my employees at work and just the amount of questions that we all get. There's opportunities for us to point people towards the Lord and to keep the gospel central to this circumstance. This circumstance is no different than others, and the Lord is central in that. So we try to take that approach, but I have to be careful. I'm human just like anybody else, and we can be guilty of taking our eyes off the Lord and in that perspective. But that's certainly the goal. And yes, I'm concerned. Back to your first question, and have a fear as a man, but I do know that I'm comforted in that the Lord is in control.
I think early on for me as a follower of Jesus, the attribute of God's character that comforted me the most was his constancy. He's steady. He doesn't change. For me as a new believer, and even this week in the middle of all of this insanity, that he is the rock upon which we stand, the anchor for my soul, that in him there is no change, no variation, no shadow of turning. He is the same yesterday, today, and forever. That I'll wake up tomorrow morning and his mercies will be as new as they were this morning, is of incredible comfort to me. The church has something to say into this whole mess. I mean, we really do. I think there's a good portion of our population who are legitimately afraid, and perhaps reasonably so. But we have a Savior in Jesus who used to be dead, and he beat it, and he's alive. The message of the church is unchanged in all of this. God loved us so much that he sent his only Son, that he would do what we could not do, that he would live without sin. The one who knew no sin becomes sin for us. Jesus died on the cross as our substitute. He rose again the third day. He beat death. He beat a bigger enemy than COVID-19. And he beckons that we would come to him and trust in him and believe in him, find forgiveness of our sin in him and the hope of everlasting life. That's a message that is unfazed by COVID-19 or any other pandemic that the world could muster up. That's what holds us together. That is the rock upon which we stand. And I want to encourage those of you who are watching who are members of Christ's body, that we're going to have to be very creative about gospel advancement. The call of the Great Commission on our life is to take the good news of the gospel across the street and around the world. Obviously, that's going to look different in the new world than it did 2 weeks ago. But that commission stands. The call of God on our life in that regard stands. And so be faithful to share the hope of the gospel with the people that you come into contact with. I think this is a good opportunity for us to evaluate ourselves to see that we're in the faith. I have felt like for all of my 15 years of ministry in the Bible Belt South, that my great opponent was not the new atheism or antagonism from some other precincts, but really what I have called a folk Christianity in the Deep South that has co-opted the language of the gospel, but it does not save. It doesn't bear the power of God. And we need to really be careful that we're examining ourselves to see that we're in the faith. I'm preaching right now through 1 John, and 1 John gives us a number of ways to evaluate ourselves. John says, if you walk with him, then you must walk in the light as he is in the light. There is no darkness in him whatsoever. That when we love him, that we'll love the brother. That when we love him, we'll obey his commandments. We need to really shore up and evaluate ourselves with regards to our relationship with Jesus. I am hopeful and optimistic that this is creating new opportunities for the church to minister to our community. There'll be people that'll watch this panel that'll never darken the doors of Longview Point Church. But again, it's an opportunity for us to extend a hand, to be the hands and feet of Jesus in our community. And so for church folks listening, I just want to encourage you, continue to support your faith family. You're not only does the world need the church, but your church needs you right now in some pretty major ways. To be faithful to share the good news of the gospel with those that you come in contact with, and hold fast to the rock-solid promises of the gospel. I'm not saying that we're unaffected by what we're walking through now. Obviously, all of us have been impacted in great ways, but God has not given us a spirit of fear. I'm walking confidently through this, and I trust that other Christ followers are as well. Thank you guys for coming today. I really appreciate your willingness to be with us this evening, and I trust that this will be informative and I hope helpful to the folks of our community. Thank you guys very much.
Thank you for the invitation.
Can I say one thing?
Sure.
Well, the good Lord puts no more upon us than what we can handle. We are a strong community. We just need to take the guidance from our medical professions and be responsible people, and let's get through this.
Amen. Amen. Thank
That's
you,
what
Tom.
I'd like
Thank
to
you,
see.
Cory.
Thank you.
Thank you, Chris.
Absolutely.
Thank you, folks.